Hello, Dr. Vikki Petersen here. I wanted to talk to you today, and I think this is going to be kind of a 2 or 3 part series on something called inflammation. If you haven't heard about inflammation, you definitely need to listen and learn about it for the sake of your health, your family's health, friends, etc. The way I like to describe inflammation when I'm lecturing is that it's kind of a double-edged sword, and there's a good side and a bad side. So if you cut yourself and you know it gets kind of red, that's good inflammation. That's your white blood cells rushing into the area and killing off the bad bacteria, and that's why you don't have to often do anything to a cut when you're healthy. It heals. It might get red and sore, and once again that's the inflammation, but then it heals by itself and all is good, right? So that's the good inflammation. The bad inflammation is inflammation that kind of gets out of control. In other words, inflammation should come up and destroy the bad guy, whether it's a bacteria, a cancer cell, viruses, something that the body, it's not healthy for the body to have. And then once that war is over and the damage, the bad thing has been damaged and destroyed by your immune system, then the inflammation stops, it goes away. You can use the analogy of being out in the woods and starting a fire and to cook your dinner, which is good, keeps you warm, cooks your dinner, but then what's very important to do before you go to sleep is put that fire out, otherwise you might wake up in the middle of a forest fire in the morning. Well, that forest fire would be that inflammation, that fire out of control, which is what's causing so many Americans to be ill. So what does chronic inflammation cause? It causes heart disease, it causes diabetes, it causes cancer, it causes obesity, it causes dementia, it causes depression, it causes autism, it causes autoimmune disease. What did I forget? Nothing. I added autoimmune disease, and we can come back to that later, but that is also an immune system out of control, and inflammation is kind of the beginning of that. But that list was a fairly long list. It included the top killers of most Americans: heart disease, cancer, diabetes, and autoimmune disease. And obesity, obviously, is very, very chronic. So it's interesting. Dr. Mark Hyman had a good line. He's kind of brilliant with those good liners, good one-liners. But he said that the doctor of the future would not be a specialist the way we have now. We have gastroenterologists and endocrinologists and cardiologists. He said the doctor of the future, they'll all be inflammologists. So maybe a little tongue-in-cheek, but not far off from maybe what's really needed, which is doctors that really understand inflammation and they get to that root cause. Because the beauty, the good news, so we have the bad news that so many of these diseases we're suffering from come from this root cause, inflammation, and it's out of control. And that's why we're seeing diabetes and pre-diabetes in our 9-year-olds, for goodness sakes, and early heart disease changes in our pre-teens. We've got certainly a lot of overweight in our children. Some children are so overweight, they have so many fat cells that it would be impossible for them to ever be normal or thin adults. It's gone past that threshold. So we have a problem with this inflammation. So that's the bad news. But the good news is that it's not hard to turn it around, to really make a difference and pull yourself back from that precipice of truly a forest fire. So it might be smoldering and starting to leave your campfire and spread out a little bit, but it's not a full-blown forest fire that needs helicopters coming in with water. Okay, I'm from California. We see these things. So what I want to do today for this video is focus on what we shouldn't do, okay? So then the next video will be on what you should do. But let's focus on dietarily. And this is all diet. I mean, you do have a choice of what you put in your mouth, right? And I know there's cravings and all of that, and we'll get to that, but we do ultimately have a choice of what we choose to put in there when we open, right? When we open that mouth. So let's look at some of the key things. Sugar. So sugar is inflammatory. What's even worse is high fructose corn syrup. highly inflammatory, along with artificial sweeteners. If I had to choose between those three, and you said, I have to have something, what would it be? In moderation, sugar, hands down. Definitely not high fructose corn syrup, and definitely not the artificial sweeteners. And of course, if you really have some inflammation problems, very, very little, if any, sugar. Maybe a little bit of honey, a little bit of maple syrup, something like that, okay? In the refined carbohydrate area, beyond the sugar, refined flours, so the white flours, the processed starchy type of things that you can buy, the cookies and the crackers and all of that processed food. Someone said to me, well, what about whole grain bread? I love that question, you know, because gluten and wheat aside for the moment, let's say it's even made of, you know, rice and millet, non-glutinous grains. Can a bread in and of itself be a whole grain? You have to understand the whole grain would be that piece of rice or that piece of millet, and you know that's kind of a hard entity unto itself. Could you make a bread out of the rice that you cook? No, you'd have to grind it and refine it. And so by nature of it being a bread, the grain, whatever grain they've used, has been turned into flour, which is highly refined, and these do tend to be more inflammatory. So when it comes to bread, if you're really inflammatory, you want to steer away from it altogether and really go with whole grains that haven't been refined. GMOs, nothing good to be said about GMOs. No, that's not a lot of hype. It's not politics. GMOs are bad. We'll do another video on those. Fast food, really nothing good to be said about fast food. Highly processed food. You know, if it didn't grow recently and you didn't pick it or go to the store where they picked it like a fruit or a vegetable, if it's been in a wrapper for a long time and in addition to fast food, it's not real food. It's just not. I'm sorry. It just isn't. So there's so much real food out there, and I know this is a big transition, and you might be saying, gosh, everything I eat, you know, Dr. Petersen is saying not to eat. I get it. You're in very good company. But remember, we're just going to kind of go over the bad stuff first. Next video, I'll go over the good stuff, and we'll just do a transition, okay? We'll just sort of steer away from the bad, do more good. You'll start feeling better and really see the changes. Bad fats. So they talk about saturated fat, but remember, coconut oil is a saturated fat, and it's really good for you. But other than coconut oil, saturated fats and trans fats you want to really avoid. Those are on the label, the trans fats, so if you're looking at a label, it's mentioned. But then there's rancid oils. You know, you can be eating, you know, if you buy nuts in a can, they're rancid. Those are bad oils. Very highly inflammatory. Oils can be so good for you or so bad for you. So don't get your nuts in a can. You know, go to a farmer's market and get them, or you know, there's stores like Trader Joe's that I very rarely have seen rancid nuts in if you get the fresh nuts. So you want the raw nuts. If you want to toast them yourself or put some salt on them later yourself, that's fine. But get them either dry roasted or fresh, raw is the best way to get your nuts. Dairy products are very highly inflammatory. The animals have their own hormones. They're fed hormones. They're fed a lot of antibiotics and chemicals. Dairy products in this country are highly, highly inflammatory. I have not met a single patient, honestly, who literally and honestly was off dairy products for a full month, you know, 4 to 6 weeks, reintroduced them and didn't feel terrible, didn't have some reaction where they went, oh my gosh, I really react to dairy products. 1 for 1. It's amazing. That's not the same for gluten because it's more genetic. Different conversation, but dairy 1 for 1, you know, it's amazing. So then we mentioned the hormones in dairy products. Same thing with the animals you eat, the beef that you eat, the chicken that you eat. You want to avoid animals that have been fed hormones, antibiotics. They've been raised, the animal itself has been raised on a very high corn diet often, which is an inflammatory grain in and of itself. So the animals have not been fed well, and when you eat their meat, you're getting that byproduct of an unhealthy animal that's a pro-inflammatory animal, basically. Our animals in this country, sadly, are not very healthy. Now, yes, you can get grass-fed animals, you can get wild animals. The paleo diet talks a lot about that. It's a lot of work. You know, if you want to do the work, absolutely you can do that. You can get pasture-raised eggs, pasture-raised chickens who lay healthy eggs. So you can do these things. It's a little bit more effort, but you can do that, or you can do more of a plant-based diet, which is easier because you don't have to worry about so much of the meat. But that's up to you. Exercise is very important, so people who are not getting any exercise are not getting the anti-inflammatory benefits of exercise, so we'll be talking about that when we talk about the good stuff. Drugs, there's drugs like NSAIDs, non-steroidal anti-inflammatory drugs, some of the most popular over-the-counter medications, steroids, so these are drugs that are very inflammatory. Even it's funny because they're anti-inflammatory drugs, but long-term they cause inflammation and a leaky gut, which creates more inflammation in the body. So it's interesting because if your body was really functioning the way it should, it would never need an anti-inflammatory drug because our bodies actually make our own anti-inflammatories, and which segues nicely into the next item on our list, which is stress, because it's actually the stress gland that makes the natural anti-inflammatories, your adrenal gland. So when you're under a lot of stress, you're going to be more pro-inflammatory. So, you know, sometimes stress is very difficult to control. I completely understand that. But if you know about it, you can make those little extra steps. And one of my favorite things is I take a hot bath at night, which is my quiet and relaxation time. And that's actually a very valid therapy. So something that you can do, you know, like take a bath or do some yoga or do some deep breathing. There's things that you can do with no money and very little time that can really make a difference if you know that that's important. So you know that the stress level is high, so you can do some things for yourself that are going to lower that stress. Last but not least, food sensitivities. That sometimes you need a little bit more help with, and I understand that. I mostly want to give you things that you can do on your own. The most common food sensitivities are gluten and dairy. So a lot of times when people are trying to clean up and go on an anti-inflammatory program, they take gluten and dairy out of their diet. So I think that's enough for today, enough food for thought, but look at those items and really see what you can do, and maybe, you know, say, what are the biggest three for me that are really an integral part of my diet that I really appreciate now are not good for me? Let me just work with those three, you know, start with 3 at a time. I probably listed 8 things, so that could be a little overwhelming. So we'll start with 3 and then kind of move in that direction. And then stay tuned for the next video where I'll tell you all the good things that you should do. But seriously, getting to the root of inflammation and lessening it in the human body can do so much to move you away from and heal you from these diseases that we're trying to avoid. So I hope you found this helpful, and until next time, I wish you very good health.